Hello, my name is Emily Marble. I'm a student at Frontier Nursing University. My paper is on the relationship between depression and the risk of substance use in adolescents. When substance use and depression occur concurrently in young people, it can be a daunting situation for individuals, families, and healthcare treatment teams. Mental health problems and substance use are linked in a complicated correlation, and understanding this relationship is critical to implementing viable solutions to assist youth with these health issues. Here's an overview of my paper. There have been conflicting studies in the past to attempt to determine if substance use is caused by depression in adolescents or if depression makes young people more likely to initiate substance use. A recent study regarding this relationship shows that substance use and depression are bidirectional, meaning that both of these pathways seem to be active in this relationship. Negative urgency and internalizing symptoms have been linked in new initiation of substance use in adolescents, and screening for these may be helpful in identifying adolescents at risk for substance use. Substance use and depression are unfortunately common in adolescents and many times happen in conjunction. Authors Wilkinson et al. Published a study about these directions between substance use and depression symptoms and revealed that there's a dual relationship regarding these behaviors. These results seem to indicate that young people attempt to self-medicate symptoms of depression with cigarette smoking in females and with marijuana use in males, but this self-medication was ineffective in providing lasting relief. Depression in a study by Stepinski et al. Showed that teenagers with depression were 40% more likely to begin using cannabis for the first time than an adolescent without depression. Unfortunately, treating depression with substance use does not seem to be effective. In contrast with the substance use as a form of self-medication for depression among young people, the same study showed an increase over time in depression symptoms among people who use substances. Young men and women who smoked tobacco experienced increases in symptoms of depression, with females having the strongest connection. This finding shows that substance use is ineffective, and also another depression increase with substance use by the CCSA showed that substance use can create difficulties in adolescents' family and social dynamics, which can contribute to depression and other mental health problems. They said that young people may experience these adverse interactions with parents, teachers, and law enforcement, and that can increase negative feelings and emotions. Some contributing elements to the new onset and increase in frequency of use of substances in adolescents with depression is negative urgency and internalizing symptoms. Authors Pang et al. Linked negative urgency, which is the tendency to make rash choices during an emotional state, as a mechanism of new initiation of substance use in adolescents. These feelings involved in depression can accumulate to influence adolescents to act without thinking ahead about the potential consequences of their actions. Emotional vulnerability makes it more likely that a young person will experiment with various substances, especially at an early age. Pang et al. In their study showed that the age that an adolescent begins using alcohol or marijuana has a significant adverse impact on long-term outcomes. They said that as a result of these findings, it is critical to treat adolescents for depressive symptoms before they begin experimenting with substances. Internalizing symptoms are symptoms of emotional distress that are focused inward as opposed to being expressed outwards. And these symptoms have been linked to a new onset of cannabis use in adolescents. Adolescents who used cannabis in the study by Stepinski et al. Also had higher rates of panic and depression symptoms. They felt less connected to their educational communities, and they were more likely to have used other substances, including alcohol. This confirms the finding in the Wilkinson et al. Study that proposes that adolescents who use substances experience an increase in depressive symptoms. All of these elements go to suggest that substance use prevention tactics should include screening all adolescents for depression and internalizing symptoms, as these are risk factors that indicate young people with a greater likelihood of using substances such as cannabis and tobacco and alcohol. Here's my reference page. Thank you so much for your time.